audience today know CFAR, but for those of you who don't, just a very quick overview of who we are. So CFAR stands for the Center for Applied Research. Our name actually dates back to our origins as an applied research center inside the Wharton School at Penn. Today, though, we continue the tradition of applied research and active learning, both from the literature and also our day-to-day experiences. And we apply this thinking to some of the stickiest and thorniest challenges that our clients face. Today's webinar is informed by work that we're doing across the entire healthcare ecology, where we're partnering with healthcare leaders on issues of strategy, culture, change, leadership, and governance. Sometimes one of those things, but you can imagine all of these things sort of are at play, no matter which is in the lead and which might be in the shadows. But it's certainly been an interesting year for healthcare, and we have spent a lot of time helping organizations creating or refreshing their strategies, but also supporting them as they bring those aspirations to life. So we found that implementation is often a sticking point, and we thought it might actually be helpful to share some of what we have learned about how to advance effective implementation. So you've heard a little bit about us and a little bit about why we chose this topic for today. But now I'd love to learn a little bit more about all of you who are joining us today. So please take a moment to respond to this poll, and then it'll give us a quick snapshot of who might be in the Zoom room today. Great. So can we see the results? Do we have results? Oh, great. Okay. So I don't know if everyone can see this, but it looks like we've got about 24% of folks representing a health system or hospital, about another quarter in academic medicine, a couple folks from representing life sciences or research, and then another about 9% who are coming to us through the association, certifying board, accreditation board, et cetera. And thanks to those of you who are using the chat to share a little bit more detail about who you are. That's awesome. Okay. Well, speaking of the chat, I would like to just, before we jump into the content, just talk a little bit about our objectives for the day and also just a little bit of housekeeping. So our objectives today are threefold. First, to identify some common challenges that get in the way of effective strategy implementation. We're going to look at four. There are many challenges that get in the way of strategy implementation, but the four that we are looking at today are some that we think are really important, and also something that you actually have a little bit of control over. The second thing we'd like to do is share some examples of methods and tools and ideas that can be used to sort of mitigate these challenges. These are examples. If you have examples, we'd love for you to share them in the chat. But I think, that would be really terrific. We're going to share some examples. We'll also have an opportunity at some point in the future to, kind of engage in possible conversation to share some other examples. And finally, we want to learn from each other. We know this is a webinar, but part of our ethos is the belief in the power of the collective. And we're excited to learn from your experiences as we continue to learn and refine our own craft here. So hopefully we'll have an opportunity to do that. And how will we do it? Well, Daphne and Chris and I are going to present for, 35 minutes, 40 minutes. During that time, as you can see, the chat feature is going to be open. You should feel free to add comments. If you want to have questions, we'll do our best to monitor the chat along the way. But at the end, we want to leave time for some Q&A. And if you wouldn't mind, any questions that you would like us to try to address in the Q&A, please go ahead and use the Q&A feature at the bottom of your screen. And that will give us a sense of all the questions that are coming in, and we'll do our best to answer those, as many as we can in the time allotted. Finally, you may also be wondering if we plan to share our slides. The answer is yes. The slides and a recording will be sent as a follow-up to today's webinar. So feel free to, take it, use it at your leisure, but also share it with others if you think that the content would benefit folks that you know who might be struggling with some of these issues. Okay, so let's go ahead and dig in. So, as you know, there are many schools of thought about strategy, but in the end, strategy is really about choice. So, what are you going to do? And also, what are you not going to do, right? To most effectively and impactfully advance your mission and vision. So, the graphic here represents CFAR's own approach to strategy making. You will see that the steps look pretty familiar, right? First, you want to understand your starting point. We believe that's really important to have a shared point of view about your starting point as a foundation from which to kind of think about the future. Then, of course, you want to think about, well, what are our options? What are the future possibilities that we might aspire to? Then there's work to choose. Again, going back to what I said earlier, what are you going to choose to do? What are you going to choose not to do? And then ultimately to kind of pull all of that together in your strategy document, which captures, a point in time of what you're saying about your priorities for the institution. But the way that we enact these steps is a little bit different, and it's informed by what you see in the title of this slide. So we always start with the end in mind. And in this case, what do we mean by, in the end? Well, in the end is how will you actually engage people across your organization to understand, commit to, and work together to enact the strategy? So I think you probably wouldn't be here today if you didn't share the opinion that having a strategy is just the beginning. It's important to recognize that strategy is also not just like a technical process. You don't want to just go in your room and kind of like come up with a list of ideas and, lay it out for everybody. Strategy making is really a social process. Strategy making can also bring hope and excitement about the future, but it also can bring change and confusion and anxiety. And so, one of the first things that you should think about as you work to increase the likelihood that you can implement your strategy is by actively engaging those who will be most impacted by it in the actual shaping of it. So, in doing so, right at the beginning, you're already preparing an army of supporters who not only understand it, but who can help you implement it from the get-go. The other thing to notice here is our approach includes this important fourth phase called ACT. And this is the work of organizing people and metrics and accountabilities to take the ideas from the page and actually put them into action. And again, kind of easier said than done. So we know for sure that there's no shortage of challenges that can get in the way of strategy implementation. As I mentioned earlier, some of these things are undoubtedly outside of your control, but other things you can actually influence and be quite intentional about. So a couple of things that we are going to look at today are four that we think are controllable and also can make the biggest difference to your ability to actually bring some strategy to life. So let's take a look at these core challenges. Okay, so the first challenge that we tend to see is the inability to embed the strategy. So you've done some work to create a strategy, but we often see if leaders of an organization, maybe they've worked really hard to develop a strategy, but for whatever reason, have failed to engage others or possibly set up the accountability structures to link authority and metrics and timelines to really activate priorities. The strategy could roll out with fanfare and videos and websites and things, but people across the organization might be wondering, like, what is this? Why are we doing this? Like, no one asked me for my opinion. Maybe this doesn't pertain to me in my work. So you could end up with a beautiful strategy that people aren't prepared to support or really know how to enact if you're not effectively able to really kind of put in place the mechanisms to embed the strategy, right? And make it real for people. The second challenge is really about unclear decision rights. So we also see this time and again as strategy starts to get rolled out. If there's confusion about who carries what authority and decision-making abilities to set priorities, make changes, allocate resources, things can get lost in the shuffle, duplication of effort can happen. Daphne's going to talk a lot more detail about this, but decision rights are absolutely essential when you're actually bringing strategy to life. The fourth piece, we think about communication and more specifically, inadequate communication. This is a common issue. It is a challenge in every organization, but it can be particularly problematic if it's not done well in launching and sustaining strategy. So it's so important to use communication to help people connect the dots between like their work and the organization's purpose and priorities. And striking the right balance can sometimes be hard, but sharing stories, keeping people engaged about progress, for better and for worse sometimes, can really help keep this strategy in focus and people actually engaged in the work of advancing it. And then finally, the inability to learn and adapt can also be a big challenge, right? So this is the thing everybody talks about, like, oh, we don't want to create a strategy that sort of sits on the shelf, right? It collects dust. So we are living in a time of a lot of change. Things, are different. From the time you wake up in the morning until the time you go to bed at night. And unfortunately, that's unlikely to change anytime soon. So ensuring that you have mechanisms in place to adapt your strategy to the on-the-ground realities is so important. And Chris is going to talk a lot today about some ways that you can really do that. So in the end, this is not rocket science. And even some of this might seem, sort of basic, right? But we can tell you that over and over and over again, we see organizations sort of blow past some of these issues. And in doing so, it really impedes their ability to effectively advance the work that they're trying to advance and to achieve the aspirations that they've set out in their strategy. So I'm going to now turn to Chris and Daphne to take a closer look at each of these challenges and share some ideas and thoughts about ways to tackle them. And I think, Chris, you're going to get us started.
That sounds great. So, in order to proactively tackle the challenges that Jen just laid out, what we're recommending you all think about is what we're calling an implementation engine. And really, it's composed of four parts, each of which is designed to directly address one of those challenges. It starts with an implementation infrastructure, which helps you map your strategy onto your organization, continues through decision rights so that your decision makers and leaders can address emergent challenges and live into the new strategy. And then we're going to dig a little bit more into what that communication strategy may look like so that you can keep everybody on the same page. And then also seed the last part of this cycle, which is the learning loop, where you take in new information and adapt your strategy as you go forward in order to make sure that it's meeting all of your needs. And I'm actually going to go ahead and dig into this first one around the implementation infrastructure. And to do that, I want to underscore a point that Jen made earlier, which is that a lot of work goes into creating these strategy documents, and they're well formatted and they're very beautiful. But there's a set of steps that need to happen between the creation of that document and the actions and success that you hope come out of it. And in order to map all of those great ideas onto the organization, you need a plan, not just for what you're going to do, but how you're going to distribute that work to the people who are ultimately going to be tasked with doing it. And we wanted to share an example from a recent client. This is actually a large department within an academic medical center that took on a strategy, but they didn't really have the right kind of organizational structure to distribute the work. So what they did is they actually created their own structure that was designed to give each of their goals, which you'll see on in the bottom part of that graph, those dark blue rectangles, each of those goals had a responsible party. And that was essentially a cross-functional team that was brought together to, in addition to the work they were already doing, bring in that goal and form a plan for how they were going to enact it. And then each of those pillars that you see also has a senior sponsor who's in charge of coordinating the work in that pillar, removing roadblocks and mentoring and advising the people that are taking on the task on the front lines of getting these pieces of work done. And then one thing that the structure really did for them was it enabled a really seamless way of deploying different kinds of resources across the implementation. For instance, project management resources, or even resource or human need requests, capacity, et cetera, so that they could really surface problems that came up, take advantage of opportunities, and really be able to drive the work in the best way possible by really mapping the strategy again onto the people that were going to be doing that work. But there's another important piece to this, which is being able to, within each of those teams or individuals that are taking up different pieces of the work, how are you going to make sure that they're being held accountable for doing what they're being asked to do? And for that, we recommend a very simple, consistent template that, call it a work plan because that's what it is. And it's simple by design because you really want people to be able to look at this and get it right away and be able to just list out what their goals are, what are the actions that they're going to follow in order to achieve those goals, who is going to help them do it. In most cases, it is a team. And then when are they going to do it? And then last but not least, what's the status? How is it going? And this does a couple of things that are really important. It's granular, right? We're at the sort of ground level, but it really rolls up to the actions that you need, which is now that your senior people can look across the implementation and see what's working and what's not at a glance so that they can know where to deploy resources or more help. And also, the people who are doing this work, they can have a really clear picture of what's being asked of them. And in our experience, the breakdown often happens when there's a great set of strategies, there's a great set of ideas, but people don't know how to start. They don't know how to incorporate it into what they're already doing. And this is a really simple way of getting that done. And then last but not least, we think it's really important to communicate commitment to the strategic implementation long term. And one really great way of doing that is building a calendar. This is another example that you'll see from a recent live client project. And essentially what it shows is we're going to be meeting at periodic times to integrate, to learn from each other. And in between those times, we're expecting these teams to get this work done at a certain pace. Oh, and by the way, the communication plan is running and the core team is continuing to meet. That this is a cadence that we're trying to build into the implementation so that people know when they're going to need to report back and be accountable for the work that's been done. And we have found this to be a really effective way of sort of getting people on the same page and communicating when the stuff needs to be done and how they're going to get it done. So that's just taken together. You can see that those different pieces of the implementation infrastructure, they all work together to reinforce this idea that we've mapped the strategy onto those organization and we've mapped it onto our timeline so that everybody sort of knows what to do. And if they have trouble or they have roadblocks they're coming across, they know who to talk to get them removed. And so for the next stop in the implementation engine, we're going to turn to Daphne, who's going to talk about decision rights.
Thanks, Chris. So you've thought a little bit about your implementation infrastructure, but now you also need to think about decision rights and how they influence the implementation of your strategic plan. So imagine you've made a decision, but you don't see any action coming out of that, and you're wondering why. Did you actually make the decision? Were you authorized to do so? Who did you get input from? Did you think to get input from? And some of these questions often come up in healthcare, which is, a highly matrixed and complex environment where so many pieces intersect. And answering all of those questions is really important to think about your decision rights. So let's jump in. Especially as new strategic priorities emerge, decisions don't always map on neatly to the existing structures that you might have in place. So it's really important to be clear about this. If you're not, some of the things that you might see are frustration, duplication of decisions, delays, an endless cycle of meetings. And these aren't necessarily failures, but they're symptoms that something is not working as it should be. And so if you think about it as diagnostic, it means the decision isn't owned anywhere in the structure. And so RACI is a tool that we use with our clients to help them think through this problem. And it's not necessarily going to solve the issue, but using RACI as a tool uh, enables you to have that conversation. It helps you think about who needs to be part of the decision, who gives input, and also how are you communicating it out. So in this next example, we'll look at how we've seen it play out in our clients. So just a little bit about the letters. So R stands for responsible. So you are responsible for making sure that the input is gathered, the decision happens, and you're making a recommendation to the A, who's the approver. Thinking about I, inform. So these are people who are not necessarily involved in the decision, but they need to be informed about what the outcome of that decision is. And also thinking about the people who are consulted in various ways, but also making sure that they understand that their consultation is not also them making the decision. So in this particular example, we have Jane. She is the VP of Clinical Services, and Bill, who's the Chief Strategy Officer. So the decision here is who has the authority to select and approve which community partners this health system moves forward with. So Jane really is focusing on care delivery and contracts. She thinks they should be choosing partners based on operational fit and patient access. Bill, on the other hand, so he's responsible for executing the strategic plan overall and expanding service lines. And he wants to be thinking about partners based on market analysis and strategic alignment. Neither of them are wrong. But as you can see from this chart, each of them thinks, the other has approval rights, and they're not quite on the same page about how the decision is getting made or who's providing input, who's getting consulted. So if you don't get this right, maybe what happens is Jane is running her own process, as is Bill, and you might end up with two community partners who think they will be the health system's partner when there's only really room for one. So maybe there's a delay. Legal, compliance, finance feel pulled in different directions and aren't sure which is the right one to be working on. And again, the timeline slips. It's 6 months later, past what you hoped when the partnership would start. And there's no right or wrong answer, but this is really about what makes sense for your organization, what makes sense for that decision. And in order to keep the implementation on track, just being really intentional and clear. So making sure you have a conversation about how this happens. Another piece that we'll get into about decisions is the communication. But more broadly, when staff don't get clear, consistent communication, the implementation can become invisible. People assume things aren't moving. There's disengagement, there's frustration. And when there's silence, people can fill the gaps on their own. And it's also causes some trust to erode. So really want to be thinking about what is the narrative and story that you want people to know and understand. So one framework that you can think about to do that is Know, Feel, Do by our colleagues Jeff Grimshaw, Tanya Mann. This framework helps you organize the communications. So think about, what do you want a particular audience to know? What information do you want them to make sure they have? How do you want them to feel? Is it empowered? Is it prideful? Is it warm and fuzzy? And then also think about, what do you want them to do as a result of receiving this information and communication? All of this is in service of the implementation. So in an example, in a health system, this particular Know, Feel, Do framework we use to think about communication to the frontline staff. So we wanted them to know, why is it important that we have a strategic plan? We wanted them to know the key pieces of that plan. And yes, there's a change coming, but the sky is not falling around you. Leadership is committed to making this as stable as possible. And as a result of this communication, we also wanted them to feel like they had an impact and that their voices were heard. We also wanted them to feel like they were valued and their contributions matter. And we also wanted them to think about having confidence in the leadership and in the direction that the organization was headed in. And as a result of this communication, we hoped they would become ambassadors and educators with their colleagues and staff and let them know about the strategic plan implementation. We wanted them to ask questions and engage. We didn't want this to be passive, but we also wanted them to start thinking about how this would impact their work, which is really important as you think about implementation. So no matter the communication, we think it's really important to use this framework, but you do have several options in terms of channel. And this is to help you think about what is the right communication. We want to make sure it's targeted, and each channel can have a different purpose. So the point here is to match the message to the particular medium of your choice. So for example, formal channels, really good for broadcasting decisions and milestones. Informal channels might be really good for pulse checks, check the temperature to see how things are going. Biweekly updates can be wins, data snapshots. Year-end reporting would also be pretty good for a win and a really good way to highlight the impact that you've had so far in your implementation. The goal is to balance, informal and formal ways and create a rhythm so people know what to expect in terms of updates, give them opportunities to give feedback, and also how they can engage and ask questions around the implementation. But the more you communicate, the more you learn. And so this is a good way about thinking about how you might need to adjust in your implementation plan as well. And Chris will walk us a little bit through that.
So the last stop here on our implementation engine is something that we're calling the learning loop. And the idea here is that let's say you've got your infrastructure all set, it's working really well, you've figured out the right kinds of decisions you need to be making and how to make them, and you're communicating what you're doing well, and everyone sort of gets it. Well, your strategy in all likelihood is you're working in new ways, you're trying new things, and you're in uncharted territory. And what that means is you are probably surfacing risks that you didn't see at the outset of your strategy. You might be surfacing opportunities that you haven't seen at the outset of the strategy. And you're certainly learning about how to do things better as you go. And so if you're not pulling in those signals and figuring out what to do with them, you might be pursuing strategies that aren't working, but they could be fixable. And you could be running the risk of charging ahead with a strategy that's not taking into account new environmental factors or even internal organizational factors that if you listen to them, you can figure out what to do about them. And so what we're suggesting is that you have a dedicated person or team who is responsible for taking in those signals and figuring out what to do with them. And the good news is that data can come from a variety of sources. So things like surveys that you may do of your organization or even your customers or your partners. Informal conversations that you may engage in sort of around the organization, taking a look at the progress against your work plans and why they're on track or why they may not be on track, listening to the voice of the customer, solicited input from the communications plan that Daphne just walked us through, or even things like the tracked metrics clinical metrics, et cetera, that you're tracking, or even financial performance. And so the question is, there's all of these signals out there about how it's going and what things that you might be learning from the implementation. Well, what do we do with them now? So a very simple process that you could follow would be to have the person or team that's responsible for thinking about this collect those sources of data and verify them. In other words, test them against the other sources of data to see if there's something true there, synthesizing what they learned into something digestible and actionable, and then reporting that back to the senior team so that they can dig in, make a good decision about whether this is a signal that they need to act on or not, and then based on that decision, take action. And a great example of how this works comes to us from a recent client that is working within a medical school. They had advanced a strategy a couple of years ago that was looking at curricular innovation so that they could advance the way that they were teaching medicine. And that strategy came out not too long before the rise of generative AI, which is, as we all know, having a tremendous disruptive effect, not only across healthcare, but across our economy broadly. And so they took a look at that and they said, well, we really need to do something about this. We've got to be responsive to this emergent issue. And so they looked in their organization and they found several researchers that were already looking at AI and its impact on medical education. And they pulled this group together and they said, okay, we've got to be responsive here. What do you think we should do about this? And they said, well, why don't we develop a series of training modules for our faculty who can go out and experiment on the use of AI in their classrooms and then report back to us what was working and what was not working. In essence, creating their own learning loop within this team. And in so doing, they were able to generate a lot of really great ideas around how they can use AI to support their work training medical students. And they were able to really demonstrate that they were ahead of the field at a time when being ahead in this field is not quite so easy to do. And so we think it's a great example of how this learning loop concept can really help you achieve the goals that you've ultimately set out for yourselves, but maybe you need to do it in a new way based on new information. And so that sort of brings us to the conclusion of our deep dive into each of these different parts of the implementation engine. And as you can see, that the idea here is they work together, that you put together an infrastructure that helps you map the strategy onto your organization. That will surface new kinds of decisions that you need to learn how to make efficiently and effectively. You're making sure that you're communicating your wins and your questions and your ideas throughout the organization, who then come back to you with the learning that you need in order to keep the process fresh and vibrant. And so at this point, we'd love to, we have a question that we'd love to put to the group today. And that's, as you look at these different pieces that we've walked through, these different four pieces, where would you like to see your organization grow its capabilities? In other words, which of these ideas represents, in your view, sort of the biggest opportunity to advance the way that you are implementing your strategy? And we'll give you a minute to dig into that, and we're really interested to see the results. And of course, if you have now's a great time when you're done with that one to post any other questions you have in the chat. Mm-hmm. So let's take a look at the results. Interesting. Got it. Okay, so it looks like, coming over a third of you are kind of in the realm of implementation infrastructure, but close behind that is decision rights. Certainly, communication strategy is relevant for about a fifth of you, but maybe you guys think you're learning enough, which is good news. I'm going to pull the slides down, and at this point, we'd love to take any questions you may have of the group. And Jen, I don't know if you've had a chance to take a peek. Maybe there are some already that we can dig into.
Yeah, so I'm just looking here.
Yeah. Oh, that's funny. We have an AI assistant in the chat. That's case in point, I guess, right?
What are the questions? Okay, so here's a question. All right. So this question is, how do you actually use the RACI to engage in conversation?
Mm-hmm.
And actually, I think that's a really good question. I think, Daphne was talking before about the various elements and the different types of roles. And people often think like somebody makes a decision or doesn't make a decision, right? And I think she's really elucidated for us that there's lots of ways to be involved in some of these decisions. But how do you surface it, right? Because what happens is it's in everybody's head. Like they think these things. It's not obvious, right? Until you actually pause and actually ask people, to think about, gee, for like, why are we getting stuck? And if you literally write out, what's the decision you're trying to make, and you think about the various roles or groups that need to be involved, and actually do the work of asking people, well, how do you think it is today? You actually can make the implicit explicit and then actually see the kinds of conflict potentially that Daphne laid out in her description, and then just have a chat about it, right? Like, how do you negotiate this? Like, who really should be doing this? And I think it's a really simple way to, again, kind of make the implicit explicit and then to actually do something about it and help people really understand, like, who gets to, to say what, who gets to make these decisions going forward. So I don't know, Daphne or Chris, if there's anything else you'd add to that one.
I think that's just right. And, sometimes it's in the illumination of differences that we really get to the meat of why a decision is getting held up for some reason. And so oftentimes asking individuals to chart how they think a decision ought to be made. And then when you hold it up against how another relevant party in that decision thinks a decision should be made, you start to get at and can, in a depersonalized way,
Yes.
unwind why it is this is going on. And it's oftentimes in the sort of making that explicit that you can say, okay, well, what about this? What about that? And you can form an agreement that oftentimes then has implications on other decisions, and thus you start to develop a sort of shared understanding of how it all should work.
Absolutely.
Great. Thanks, Jen and Chris. So we have a few more questions rolling in. So our faculty/culture do not like SMART goals as a result of the strategic plan. They prefer to have wiggle room for interpretation. How do we evolve this culture?
That's really interesting. And if I understand your question correctly, it's that you're hoping you can move more into the culture of something that approaches a SMART type of goal. And I think that what I might consider starting with here is look for places where uh, there are already people that are kind of advancing closer to SMART goals. And oftentimes we would call this a found pilot. If you can find teams or individuals that seem to be thinking about metrics in this way and are making really good progress, you can amplify those examples and you can say, wow, look at the great work that's happening over here. Why don't we have a conversation about why that's working so well, and let's figure out why it's working so well. It looks like it's because this is measurable and it's time bound, and wow, it seems like that's working really well. And it's just sort of helping people see that it actually helps them to uh, adopt some of the thinking that's inside of that framework. That might be one way to start. But Daphne or Jen, I'd love to hear your thoughts as well.
I'm thinking back to the learning loop. There may be some anxiety about having metrics and not being able to meet them. So
Mhm.
reminding people we are a learning organization. If you don't meet that metric, I'm sure there's something that you learned along the way. You will not be held, at fault. So being thoughtful about what is the culture around learning and failure.
Yeah.
Mhm.
And I think just the one thing I would add to this, and we were actually working with an organization right now that's kind of grappling with this, and what we're talking about is trying to make the goals smarter. Right. So we're not going right down to the SMART goal specificity, but we're really thinking differently about, like, what would count as evidence that what we're doing is actually making a difference, and kind of going against the idea of just having like a ton of metrics that are hard to actually measure and hard to keep track of. But like, in a world where you're already measuring lots of things, like, can you start by really trying to connect the dots between what you're trying to do and some of the broader metrics that you're trying to advance, and help people see the impact of their work in those ways.
So
Mhm.
our next
Okay. Yeah.
question,
Oh,
uh,
Stephanie.
what if the resistance to change feels so heavy?
I'm
It's a
happy.
great question.
I'm happy to take
It's a
that
great
one.
question. We do see this a lot. People have you call it change fatigue, whatever you want. It is oftentimes the case that, particularly when you're trying to advance a strategy that's quite a bit different from what was there in the past, it is often the case that you will come up against resistance. And in our experience, the an important piece to this is really getting inside why that resistance is there. And oftentimes it is because there is something important that we need to learn from that resistance, whether it's, hey, you're leaving behind the old guard and that doesn't feel fair, or we're afraid that we're moving away from the mission if we do this thing. There's something important that we need to learn about that resistance, and in working with it, we start to understand what it is that we need to take from it, and that could then result in adapting the strategy. It could result in applying resources that you didn't think you needed to apply, but now you know you need to. But there's oftentimes working with resistance rather than ignoring it, or trying to work around it, or assuming it's not there, or trying to bulldoze right over it. In our experience, it's better to try to get inside it and understand it first.
Mhm. 100%. If you ignore it at your peril.
Right.
Right.
Yeah. Um, a- Another a good question that's up here is, what if there's a leadership transition? Can we still implement a strategy process like this? We see this a lot. Oftentimes, it is the case that strategy formation either happens in the middle of a transition or right after, et cetera. And I think the short answer is it almost makes this more important, because what's happening is you've got an infrastructure that's undergoing this leadership transition, but it needs the stability that this kind of infrastructure actually gives you. And so being able to have that in place enables an incoming leader to say, okay, how is this laid out? Where are the levers that I can pull here? And I think being able to have a good communication strategy, and you've got decision rights laid out, and you know how you're learning from the organization, all of those things are really going to help a leader step into a role and know what to do and get onboarded quickly.
We have a few more questions.
There's some good ones.
Mm-hmm.
So, someone asked, this feels like a lot to do in addition to increase caseloads and pressure to see more patients. How can I help my team to think about this as complementary rather than additive?
Yeah.
I'm happy to start us off, and then Jen and Chris will pass it to you.
I have some thoughts.
One thing we say about strategy is that it's about choices, and that's as much as what to do as what not to do. And so as you're thinking about the strategy process and the implementation, you need to answer, what are we currently doing that doesn't quite fit into the strategy that maybe we should either pull back or stop? But Jen, Chris, what are your thoughts?
Well, I can jump in because I think absolutely underscore your point about priority setting, especially in healthcare and especially in academic medicine. Everybody's so ambitious and has tons of energy despite the burnout and despite everything. Like, you want to do these things, and there's just like this list of, we're going to do all of this stuff, right? And not everything is equally important. Maybe some stuff could be in the next, year two or year three. What do we really have to do to move the needle? Not just all the great things that we think could be helpful. So it takes some discipline to do that. But we find that once you start doing the work, like, it becomes pretty clear about what's more or less important, and then you can use that to pare back. I think the second thing is, I was thinking a lot when Chris was describing that implementation infrastructure, and the case that we described, it was a group actually in leadership transition. And so under normal circumstances, you probably have the senior team in place, and you've probably got a structure that you can just piggyback on, right? Like, you've got these meetings in place, you're adding these stuff to the agenda. You're not like creating new structures and new things. And so in that case, we didn't have that because there are a lot of interims, and there are different things that were happening. So to the extent possible that you can think about these ideas and implement them on the backs of what you're already doing. Because it's like changing how you're using your time and changing what you're doing versus feeling like you're layering on more and more and more stuff to people who are already, having a hard time figuring out like where to put their time and attention.
Mhm. Yep. I wanted to raise a question from the chat that says, given the pace of change in healthcare, how often do you advise organizations revisit or refresh their strategy? This is a really interesting question and one that I actually recently wrote an article about, so I feel the need to weigh in. But in essence, what we're seeing is, several years ago, call it 10 years ago, back when the environment was relatively stable, we saw a lot of 5-year strategic plans. And the sort of classic 5-year strategic plan approach made a lot of sense in an environment that was relatively stable. Capital was stable, the policy environment was stable, et cetera. But now that all of those things are more called into question, what we're finding is that a much more adaptable approach to strategic planning. We're seeing organizations add a 6th year to that 5-year plan that they set out several years ago. We're seeing them do mid cycle revisions and very like clear pivots away from certain things and towards other things. But what they're also doing in the process of that is they're setting their sort of forever purpose and their kind of um, unchangeable sort of organizational identity that underpins everything that they're doing, even if the specific tactics that they're pursuing are somewhat more fluid. And so I'll give you a bit of an MBA answer here, which is that it depends. Size of organization, industry you're in, et cetera, is going to really have a big impact on what you think your planning horizon is. But in general, I would say that those planning horizons have shortened considerably, and organizations are pursuing a much more adaptable approach to the planning cycle rather than assuming it's going to happen at this kind of set year cadence.
Yep. Totally agree. Much shorter sprints. Yep. Right. I was looking at this question here. Someone raised, how can someone pivot their group project towards effective strategy implementation after joining a group project in the midst of what feels like ineffective strategy execution? And it sort of got me thinking a little bit about some of the work we do around change. And I think one of the questions, maybe as somebody with like a fresh set of eyes could set coming into that group, is like trying to understand like a little bit more about like what's the case for change, like why are we doing these things, and try to like engage people in the sense of, is it urgent, is it right, maybe it's stalled because it's no longer a relevant strategy, kind of building off of what Chris was just describing, right? You do need to do a little bit of work to sort of diagnose what's underneath the challenge you're facing in that strategy execution. Is it like people don't really understand the priorities? There aren't enough resources. People feel unauthorized to do the work that needs to happen. They're being pulled in too many other directions, which aren't allegedly part of the strategy, but maybe they're superseding the strategy. So I think there's like trying to use your fresh eyes to come in, think about progress, and then work with that group to really think about like why are we getting stuck? Like what's really in our way? And what could we do to overcome those things and get to be focused on the right work.
So we still have a few more questions left. Should we kind of do a rapid fire round for the last few?
Yeah, let's just do a couple more and then we can wrap up.
Yeah.
All
Yeah,
right. How long does this process typically take? Attention spans at my org are very short.
yeah.
That is exactly why you want to try to do your best to like, was what we were talking about before, like kind of piggybacking on the existing structures, as much as possible. I think we would argue that you want to, your strategy process, can take 3 months, 6 months, 9 months, a year, or longer, depending on the size of your organization, the complexity, all that sort of stuff. But
Mhm.
if you really want to implement what you say you want to do. Like these are the kinds of things that you want to be paying attention to, honestly, for the long run. And the more you make it part of the way you do things, the less it feels like, oh great, what's the flavor of the month? What do we have to pay attention to now? So I don't know if either of you have other thoughts there, but those are some of my quick reactions.
And there's a question in the chat that says strategies are often pushed down from above, i.e., senior leadership, and the direction might not be what the rest of the organization believes it needs. How do other senior levels respond? And I think this sort of goes to the strategy formation process itself. And in general, we strongly advise a process that engages as much of the organization as possible so that when that strategy is ultimately created, it not only feels, but it is co-authored by the folks that are ultimately tasked with implementing it and having been armed with the appropriate information to make an informed decision about the strategy that ought to be pursued. And that doesn't mean that the full organization all decides. This kind of goes back to decision rights. But if they can see that their input was incorporated into the thinking and that they can see a piece of their input reflected in the work, then I think what you're going to find is that strategy feels a lot less top down and a lot more co-created, which in general means your transition to implementation is a lot smoother.
Anything else, Daphne, that you're seeing in here?
A really good question, but I think it could take a little bit, but maybe in 1 minute, if you could answer, when does this not work? My initial thoughts are when the organization's culture really needs some attention. I do think a strategic planning process could help rebuild some of the trust that usually is not that's usually the issue around why people aren't collaborating or implementing. But any thoughts from you both?
I think you need commitment. You need leadership commitment, you need resources, and you need people who understand, like, what are we doing? Why are we doing it? And how is what I do every day helping? And if you can pull all those things together, that will make it work. If you don't have those things, it's really hard. It's really hard to move forward.
I also think that the approach we laid out, I think, is pretty distinctly geared towards a healthcare environment where it is really the people that you need to mobilize to do the work. It's not machinery or capital or something else. You're really trying to engage the hearts and minds and hands of people, and that's why this approach is geared towards that. This isn't the same kind of thing you'd necessarily roll out in a manufacturing setting.
Right, great. All right, well, we just have, I think, one more slide to share with everyone. And again, like, thanks so much. We know it's like hard to take time out of very, very, very busy days to sit here. We had a number of folks let us know that they were going to be able to join for part and not all. So we absolutely will fulfill our promise of sending this out in advance. I mean, sorry, sending this out as a follow-on to the session. I think we've got one more slide that we could share. And
Yes.
just wanted to let folks know, honestly, we have our contact information will be included in the slides. And then also there's this little QR code here. If you have ideas you want to share with us, if you want to find time to chat and just, kind of talk through a challenge that you might be facing, or for, whatever reason you want to be in touch with us, if you click on that, if you use that QR code, it'll link you to options to set up some office hours. And we'll be happy to connect with you. So again, thank you for joining us today.